Gangrene. Introduction. Gangrene only affects tissues on the outside of the body. Select true or false. Correct. Gangrene can happen on the outside of the body or inside the body. Marcus has pain in his leg for no explainable reason. It started several days ago. Today he developed a fever. Should Marcus contact his healthcare provider to discuss his symptoms? Select yes or no. Correct. Marcus has two common symptoms of gangrene. He should treat his symptoms as a medical emergency to be safe. Bacterial infections are the only cause of gangrene. Select true or false. Correct. Gangrene is caused by bacterial infection or a lack of blood supply to an area of the body. Having a risk factor for a disease means that you will get the disease. Select true or false. Correct. Having a risk factor for a disease does not mean you will get the disease. Can treatment reverse damage caused by gangrene? Select yes or no. Correct. The goal of treatment is to prevent the spread of gangrene. There is no treatment to reverse the damage caused by gangrene. People with diabetes can reduce their risk of developing gangrene by checking their body regularly for injuries. Select true or false. Correct. Check for cuts on your hands and feet daily. Also look for sores and signs of infection, such as redness, swelling, or drainage. Finding and treating wounds early can help prevent complications. Thank you for using Explain.